Demo for leg muscles and innervation. Innervation of the leg comes from the sacral and lumbar plexuses. The sciatic nerve arises from the sacral plexus. It's mixed and it comes from the roots L4 to S3. Lumbar plexus gives rise to two important branches for the leg, the femoral nerve and the obturator nerve, both from L2 to L4. The sciatic nerve exits the pelvis through the greater sciatic foramen, pierces below the piriformis muscle, and travels down the posterior side of the leg deep to the sartorius. Then it bifurcates into the tibial nerve and the common fibular nerve. The tibial nerve runs down the posterior medial side of the leg, innervating all of the muscles of the posterior compartment. In the superficial layer, that's the gastrocnemius, plantaris, and soleus, which all converge to form the calcaneal tendon. In the deep layer, that's the popliteus, tibialis posterior, flexor hallucis longus, and flexor digitorum longus, which all converge on the medial malleolus to enter the foot. The common fibular nerve courses down the lateral side of the leg and then splits into the deep fibular nerve and the superficial fibular nerve. The superficial fibular nerve supplies the lateral compartment of the leg, including the fibularis longus and the fibularis brevis muscle. The deep fibular nerve supplies the anterior compartment of the leg, including the tibialis anterior, extensor digitorum longus, and extensor hallucis longus muscle. Sensory innervation from the common fibular nerve includes this area from a branch called the lateral sural cutaneous nerve, this area the anterior part of the leg, and most of the dorsum of the foot from the superficial fibular nerve, and this part in between the first interdigital cleft from the deep fibular nerve. The sural nerve is a combination of branches from the common fibular and tibial nerves. It supplies the posterolateral side of the leg and the foot. The saphenous nerve is a branch off the femoral nerve supplying the medial side of the leg and the foot. Medial calcaneal is a branch of the tibial nerve and supplies the medial skin of the heel. Medial and lateral plantar nerve are branches off the tibial nerve, and they supply the sole of the foot, with the dividing line being between the fourth digit. Compartment syndrome can occur when there is increased pressure within the compartments of fascia, leading to a fasciotomy or permanently injured area due to ischemia. Tibial nerve entrapment, also called tarsal tunnel syndrome, is due to compression of the tibial nerve under the flexor retinaculum, and it causes heel pain. Pes planus, also called acquired flat feet, is due to damage of the muscles supporting the arches. The tarsal head displaces forward and it causes pain in the foot. Lesions to any of the nerves that we discussed could cause loss of sensation and muscle weakness, for example, foot drop.